My name is Wendy Brzezowski, and I am the account manager for OT Simucase. And today I'm here to provide student training. And thank you so much for attending. We will get started by talking a little bit about simulation-based education. And so you will be using Simucase, a computer-based simulation platform, to bridge the gap between the theoretical knowledge that you're learning in the classroom and your clinical experiences. Simucase will present clients and clinical problems authentically and allow you a chance to make decisions. Along with that benefit, you will also see a benefit of having the ability to learn in a safe environment and have an opportunity for repeated practice and to learn from your mistakes. When you're first starting out in Simucase, we encourage you to go through the simulation from start to finish, regardless of the errors as you go. Make the best clinical decisions that you can, and then submit your scenario and take a look at your report. If you were with a client, you wouldn't make a decision and then walk out of the room if you made an error. So you want to approach the simulation in the same way. These are real clients, and these are clients that are having real treatment sessions, and now you are their therapist. It gives you exposure to low incidence populations and things you might not see on fieldwork, an opportunity for confidence building, and an opportunity for reflective practice. We have different content in the library, and we will look at assessments, interventions, part task trainers, and an observational video library today during our training. You will be scored as you work through the simulation. You will receive scores based on your clinical decision making, and this is a competency scoring. Your scoring will be based on how you make your decisions. Are your decisions reflective, good, sound decisions, or are you making decisions that are poor and rejected? If a decision is rejected, it will be rejected because it was redundant. You've already asked that question and now you're rewording it and asking it again, or perhaps you are applying the same assessment for the client. You're doing it twice, or you're doing two assessments that would give you the same results. So if it is redundant, if you choose to ask questions that are developmentally appropriate or apply assessments that are developmentally appropriate, if you use medical jargon, or if you're being insensitive. So if you ask something that's insensitive. There are also decisions that are judged as acceptable, which will result in no points awarded or subtracted. The points earned in each section are added together, and this will determine your overall competency rating. 90% or higher is a mastery level, 70 to 89% is a developing level of competency, and 70% or lower is emerging. We will take a look at Simucase, but first I want to review with you that these are real patients receiving real treatment, and we would like you to practice HIPAA compliance as you treat your simulation and treat them with respect. Do not share their confidential information with other students until you get to the debrief session. Make sure you're listening to their responses carefully as you go through the simulation. Many times there will be information that you will need later. Clicking on the correct question is only half the battle. You will learn the most from listening to the clients and making connections to your coursework, and also making some connections with the client as you go. So we'll go ahead and get started. In the library, you do have the choice between searching simulations and searching videos. So we'll take a look at those videos first. So the video library is available to you here, and you have access to all content in all professions. We're going to go ahead and search in the OT content first. And we'll be able to see here the OT videos will come up. So you'll see there are 5 pages of OT videos. You can search the videos by topic area, by age group, the location it was filmed, or the duration of the video. When you are assigned a video to watch by faculty, they will know if you've watched it because it will show up on the faculty dashboard in your report. So you will be able to search for videos, and say we were looking for a video with the content of lymphedema. We could take a look here under integumentary. You'll see all of the lymphedema videos will come up. If I do click on that, we can see the video. They're all closed captioned, and you'll get a brief description of the video below. All videos can be full screened. And so that's the video library. We'll go ahead into search simulations now. We're going to take a look at an intervention session today. The intervention session that we're going to look at is Frank. Frank is a gentleman who's 80 years old, and he has had a recent slight CVA, but he also has Parkinson's disease and Lewy body dementia. When you first log into your account, you'll only have the option to launch the case, but once they're launched, then you can start or restart the case. If you save and exit a case, you can use this button to resume it when you come back. So we're going to go ahead and hit restart. You'll see here you have the choice of to start in learning mode or assessment mode. You will not have the debrief mode. This is only for instructors. We are going to start in learning mode, and in learning mode you will receive feedback regarding the decisions that you make as you go through the case. When you work in assessment mode, you receive no feedback until the case is completed. So this is more of a testing mode. So we go into start in learning mode. And you'll see here that you have topics across the top. There's a clock keeping track of how long you've been working in the case. And you'll see here, show the clipboard. We want to show that clipboard, and we want to work with the clipboard open. So if you're taking notes, you'll want to write down that you want to open your clipboard. When you open the clipboard, it is just like the clipboard you would carry when you're treating a client. You will write your notes on it, you will keep paper on it, whatever you need will be there. And it's the same thing when you're working through the simulation. As we make our choices, the choices will show up here. You can also add entry. So you can make notes as you go. So if you find out something about Frank that you want to notate, you can put it here and hit save, and it will stay there for you for the duration of the simulation. We will start by starting our case study.
Frank is an 80-year-old male with Parkinson's disease and Lewy body dementia who recently experienced a cerebral infarction and a progressive increase in falls. Frank was briefly hospitalized in an acute care setting prior to being discharged home to the independent senior living facility where he lives. You are the occupational therapist working for a mobile outpatient agency who is assigned to complete Frank's evaluation.
So in this case, we chose the evaluation. I'm going to go ahead and save exit here, save my progress and exit. And we are now going to take a look at the intervention. So the assessment is one part of Frank, and the intervention is what we're going to cover today. So when we restart here, we'll get a chance to see Frank now for the intervention. So you got to hear where Frank was living, and that was the beginning of the assessment case. And now we'll do the same thing here. We'll open the clipboard. We'll start the case study, and we'll hear from Frank.
Frank is an 80-year-old male with Parkinson's disease and Lewy body dementia who has recently experienced a cerebral infarct and a progressive increase in falls. Frank was briefly hospitalized in an acute care setting prior to being discharged home to the independent senior living facility where he lives. Frank has recently been evaluated at his living facility, and you are the occupational therapy practitioner assigned to provide his intervention.
So we would then go to baseline data, and we will hear from Frank.
Hi, my name is Frank. I'm 80 years old. I feel like I've lived a full 80 years. I'm living at senior independent living facility. I've been here for about a year and a half. On my younger days, I went over to the South Pole. Spent 14 months in the Antarctic. I was working as a geophysicist.
So we get a chance to hear from the client, and then we can look at any evaluation reports that we have for Frank. These will be real reports from his actual medical record. Some of these reports may be necessary to look at, some may just be okay to look at. So remember what I had said earlier is that you're going to gain points for reflective decisions, but there could be decisions that are just acceptable. So if I wanted to look at his driver evaluation from a year ago, I won't lose points for doing so, and it will be available to me, but I also won't gain any points. So if I go ahead and look at that plan of care to get started, You can hear that we heard a positive sound. That's one of the indicators that you chose correctly. We can then take a look and see the ICD-10 codes, the procedure codes that were billed. We can take a look at the whole evaluation, and most importantly, we will take a look at these long-term goals and determine what our treatment objectives will be. So based on all of the information here, we will be able to choose our treatment objectives, which will be our next item. So if we look here, we can see that he has some goals here that he would like to work on and that were found to be issues for him. If we look at long-term goal down here that says client will implement strategies for managing freezing episodes. So we might want to look and see if there's anything that will address that. We will look at all of them and decide which ones we would like to address and which ones are available to address within the simulation. We can also see here that he has a goal to do his personal laundry and also to manage his medication. So if we go back out, we can then briefly interview Frank. If we'd like to ask him some questions, we want to ask the things that are most appropriate. You don't want to ask everything because not every question here is going to be a good question. So if I ask him, have you had any falls since your evaluation? That's a good question. So we're going to get positive feedback for that. You'll see the green bar here in the right-hand corner at the top. You'll hear him answer, and you'll see that our progress meter is starting to grow. So we're actually getting our progress meter filled up here. We want to think of this as a pie chart. The more we have this filled up, the closer we are to having 100% in the baseline area. If I want to ask him, have you had any illness or medication changes? That's a good question.
No.
But if I ask him, do you have poor insight? That would be insensitive. And when I ask him that,
this is a waste of time.
He gets kind of upset with me. The situation is different as far as our feedback. You hear a different sound. You see a red bar on the top right corner. And you'll also see a redirect number 1. So it's going to start on the clipboard keeping track of the points that we're missing if we have any errors. So we would then move on, ask him any other good questions here, and then move on to session objectives. So you'll have to read through the objectives and decide which objectives you would like to address during this simulation. So we know that he has that goal for laundry. So I'm going to look for something to work on that will work towards that laundry goal. So I scroll down, I take a look, and I see Frank will complete at least 4 steps of the laundry washing task with his 4-wheeled walker and minimal cues for safety. I'm going to go ahead and choose that one, knowing that there are other objectives that we need to choose as well. Based on him having those 8 goals, I will look for the others, but for the sake of our demonstration, we're just going to choose that one. You will have more than one here to choose. There will be more than one session objective. You will have to look for the others based on the review of his plan of care. Now in this area, once I make a choice, it will go to my clipboard. So I have my first session objective will be listed here. If I were to choose something that's incorrect, I could lose points for that, but I can continue and work through and find the correct session objectives as well. But you cannot gain points back once you lose them. Then we move into the collaborator section. We can talk to folks that have been working with Frank. So not all of these folks will be folks familiar with Frank's case. For instance, the ABA therapist, an ABA therapist would not work with somebody of Frank's age, so we wouldn't choose her, but it does say in his reports that he does have a home attendant. So maybe we would want to ask her some questions.
Hi, I'm Melissa Razai. I'm the home attendant and I help Frank with self-care in his apartment.
So same rules apply here. There will be good questions here and there will be foils. So you want to choose the best questions. If I'm asking things like, have you noticed any improvement? Tell me more about Frank's self-care. Has he had any falls? Those are good questions. But if I start asking about whether he locks his door, does he have computer passwords? Those are things that would not be appropriate to ask the home attendant. So once you've talked to the collaborators, you can move into treatment and make your decision. So we know that laundry would be under self-care and home management, or we could take a look at the PDF of all treatment options and we could decide which ones we would want to do for Frank. So if I look at self-care and home management, I see laundry and I see medication management, and those are 2 of the things that were targets for our session objectives. I also did point out that we had that goal for freezing episodes. So maybe we would want to take a look and see where we could find something to work on that. And if we look in this neuromuscular re-education area, you may find something there. When we go back out to the actual interventions, we can then choose self-care, home management, and choose laundry and administer that. And the first thing you'll be challenged to do is to do the task analysis. So we're not unfamiliar with that, I'm sure. And so we will go through and we will first determine which of the following best reflects the typical task components of washing the clothes. We'll answer the question, which of the following describes drying the clothes? Which of the following components do you need to consider when attempting a laundry task with this client? So we're going to choose a few here. And then you'll see you'll have open text options as well. These options are not graded by Simucase, but your faculty will be able to see your answers. So describe that session objective and how you'll know if it's met. So we have to put an answer here, otherwise you can't move forward. This feedback button will grade this slide for you and let you know if you have answered correctly. You can see here my answers were only partially correct in the last question. Which of the following components do you need to consider when attempting a laundry task? So I really need to think harder about this one and make some changes there in order to get 100% for this slide. I can still move forward even if I have incorrect answers, much like I can move forward even if I don't have my progress meters completely filled. So you may not get everything correct in each area, but you can still move forward if you feel like you've done everything you can do in that area. When I move on to the next slide, we'll actually be able to see him performing the tasks. So he's going to perform each area of laundry. So the first part is gathering the clothes.
To your bedroom to get your laundry, and you're going to load it up however you typically would carry it to the laundry, and then come in here and get your detergent, and then off over to the laundry area is where we're going to go. Okay, any questions about that? All right. I'm going to stop you for a second. I'm going to have you stand and get a hold of your walker. We're going to think through this just a little bit further because I'd really like to see you support on that walker. Now I'm going to have you step so that you can step right up towards the walker before you reach down to get your laundry. So this is a big load today, isn't it? Makes it a little heavy. Sometimes I'll recommend maybe doing your laundry, maybe every couple of days so that the load is about half the size and it's lighter for you to lift and pick up. Can you think of anything that makes this difficult for you?
Specifically, no.
So you think you feel pretty safe bending down to lift this up without holding on to anything? Any chances that you would have a fall?
Always a chance.
Always a chance. So one of the things we might want to think about is where could we set your laundry so it stays up and you can avoid having to lean down to pick it up and get it onto the walker. Would you be receptive to that?
You can find a spot like that, yeah.
Okay. And I'm wondering if we can maybe we can put a shelf up here or we can put a small table that can sit here and you can still reach and get into your clothes, but will keep you from leaning so far over to lift that weight up.
You can see here that
To your bedroom to get your laundry. And you're going to...
We're able to full screen that so that you could watch the video and then you can answer the questions here on the side. So these are your skills checks. So what device does this client use in his apartment? Where are this client's dirty clothes located? What strategy is introduced during laundry? And then does Frank require cues for safety? So if I were to get this incorrect, you can see that he did require cues for safety, so the answer should have been yes. So I can rewatch the video to see if she did cue him. I can change that to yes, and then I can have it corrected again for me. Then I can move on to the next step, and then I can look at washing the laundry. So that's how you do a treatment session. So you can see that we did not fill our full progress meter here. There are a couple of more treatments that we would want to get in today, but for the demo, we're just going to look at this one, and you can see that we can move forward even if we don't complete each progress meter. You can access a PDF of all billing codes right here, and you can then choose the billing codes that you would like to bill, and on your clipboard here on the treatment area, you can add those billing codes and you would just hit save. So we go to the client progress. You'll be able to see a PDF of all the potential progress that you can choose. And you're going to want to look through here and see what activities did you do and how did he do with those activities. So if we look at this number 3, did he complete 4 steps of washing the laundry with minimal cues for safety strategies? We can go ahead and go into client progress and scroll down and find number 3. And he does actually do this, so we're going to give him credit as goal met today. You see we get feedback for that, and we get a portion of our pie chart is filled in here for progress, and then we can look through and find the other items that we addressed and either say goal met or goal not met. You can also speak to whether we targeted those goals today. So you are able to say, for instance, this feeding trial, we did not do any feeding. So I can say goal not targeted. It's just acceptable to put that in there. You don't have to, but if you feel more comfortable addressing each individual item, you can do that and put goal not met there. One thing I want to point out here is once you do make a decision, you can't take it away by clicking on it. It is a permanent choice for you. So if I were to click on something that was incorrect, I would lose my progress here in my pie chart. So if I would have said that the feeding goal was met, you can see that I lost all of the progress that I made because I made an incorrect choice. I will also end up with a redirect to here on my clipboard for client progress. Redirect number 2. So now I don't have any progress in my client progress area. So if I go to summary, there'll be 5 summaries. You're going to want to read through the summaries and choose the most correct summary. So if I choose the first one and it is incorrect, I don't get any credit for it. So what we're working towards here is getting a full progress meter, but since I didn't choose the right one, I'm not going to get any points in this area. And you can also see that all of my other choices go away. So you want to make sure you choose correctly, do your best to make the best judgment. Then you can update long and short-term goals if you are assigned to, and hit save goals, and those will save to your report. At this point, you could save and exit or submit the case. I want to address the save and exit button while we're here. Please make sure that you do save and exit if you leave the simulation for any reason. If you need to go stretch your legs, if you get an interruption, need to go to the restroom, get a coffee, just make sure you do save and exit. This way you can come back and resume where you left off. If you leave the simulation open for hours on end, it could time out, you could lose connectivity and lose some of your work. So please do save and exit whenever you need to leave the simulation. And then I will show you again where the resume button is if you would save and exit. We're going to go ahead and submit the simulation though. You'll see here, you get a visual right away of how we did so far. You can see how we didn't get any credit here because we had 1 correct and 1 incorrect, so it turned to 0. We chose the wrong summary. So we only got a 14%, so we would have to start again, but that's okay. That's what we want you to do, is if you don't reach that mastery level, is to start again. You can also see here that your skills checks are graded individually. So the skills checks are broken out of the treatment, and you can see how you scored there. So of the laundry questions that we did answer, we're at a 26%. We had 2 other areas in treatment that we needed to address that we did not address. So we would make note of that for the next attempt. And then you can export your final report and see how you scored. So it'll give you your overall score. Anything that was incorrect will be in red. And then all of your skills checks are individually graded. So any question that you answered in the skills check is going to be graded. And you can see here where I had one incorrect answer for the ones that we did answer. The ones that we didn't answer will be blank and remain blank until you answer them. Now, we can't go back into the simulation once we submit, but we could decide to restart the simulation and try again. I suggest that you keep your final report or take a look at it so that you can avoid the same errors in the next attempt. So we'll go ahead and select a new simulation. And you'll be able to see here above your name, there'll always be the transcript area. And if you click on transcripts, you'll be able to see all of the transcripts and attempts that you've made for any simulation. So Frank Intervention is here. You can access the final report. So this is our final report. And so that's how you take a look at your transcripts. Your transcripts will be there for you. They don't disappear. You can see I have lots of transcripts from many, many cases that I've worked through. The last thing I want to point out for you is that you do have resources. So if you look here, you have a user guide, a quick guide, and there is a browser test that you can do if you're having slow connectivity and see how your browser is working. When you scroll to the bottom, you will also see help@simucase.com and a 1-800 number. You can email us anytime, give us a call, and from 12 to 7, Monday through Friday, Eastern Standard Time, we do man a live chat, so you can come into the live chat and ask questions. We're happy to help. You also likely have my contact information if you have a flyer with your code on it, or if you're logging in through a code, you can always contact me directly. If you have any questions, please email me. I look forward to talking with you as you begin to work with Simucase, and thank you so much. Have a great day.